Welcome to our deep dive into the world of ketamine.
Yeah.
You've given us a really fascinating mix of research and articles about ketamine treatment, and
It looks like.
yeah, and it looks like we'll be exploring a lot more than just its use for depression.
Yeah, definitely a lot to unpack.
We're starting with a research paper focusing on ketamine's effects on brain activity and depression.
Right.
Then we'll move on to a news article about ketamine's impact on brain communication in autism and Tourette's.
Okay.
And then we'll wrap up with a paper that proposes a framework for ketamine-assisted couple therapy.
Sounds good.
Okay, so let's dive right into this first research paper.
Okay.
It's called Fine-Tuning Neural Excitation Inhibition for Tailored Ketamine Use in Treatment-Resistant Depression. And it's pretty amazing how researchers are using brain imaging to actually see how ketamine works in the brain.
Yeah, it's really incredible what we can do with technology now.
So what did they find?
Well, they found that ketamine seems to be working by shifting the balance of something called excitation and inhibition in a particular region of the brain called the somatosensory cortex.
Okay, so what exactly does that mean?
Well, the somatosensory cortex is the part of your brain that receives sensory information from all over your body.
Okay.
And within this region, there's a constant interplay of activity, kind of like a seesaw.
Okay.
Excitation revs things up, increases activity,
Uh-huh.
while inhibition calms things down.
I see.
So think of it like a volume knob for your brain.
Okay.
And what they found is that ketamine seems to adjust this balance, bringing it to a more stable state.
So you're saying that in people with depression, this volume knob might be out of whack.
Yeah.
And ketamine helps to kind of fine-tune it.
Exactly.
Okay.
The study analyzed neuromagnetic data,
Okay.
which is a way of measuring the tiny magnetic fields produced by brain activity
Wow.
from patients with treatment-resistant depression and compared them to data from healthy individuals.
So they could actually see the differences in brain activity.
Yes.
Oh.
And by applying a mathematical model, they could understand how these different brain regions were interacting. They found that in patients with depression, the dynamics of these brain regions were more unstable,
Mm-hmm.
but after ketamine treatment, those dynamics shifted to a more stable state.
And that shift to a more stable state was associated with an improvement in their depressive symptoms.
Precisely.
So you're saying that by understanding how ketamine affects this balance,
Yeah.
we could potentially tailor treatment to each person's unique brain activity.
That's the idea, and it's a very promising one.
That's really cool.
And in fact, the researchers have even made their code publicly available, which means other scientists can build upon this work
That's amazing.
and hopefully speed up the development of these personalized treatments.
Wow, that's incredible.
Yeah, it's a big step towards personalized medicine for mental health.
Okay, so moving on to the next article. This one really surprised me. It's called Common Genetic Link Between Autism and Tourette's Impairs Brain Communication.
Right.
And it seems like a bit of a jump from what we were just discussing.
Yeah.
But it turns out there's a fascinating connection to ketamine here as well.
There is.
This article delves into the genetics behind autism and Tourette's syndrome and how those genetics actually impact communication within the brain.
Right.
It talks about a specific genetic deletion chromosome, 2p16.3 deletion,
Yes.
that's linked to a much higher risk of developing both autism and Tourette's.
Mhm.
And it seems like this deletion affects a gene called Nerexin-1, which is really important for brain cell communication.
It is. It's
Yeah.
like disrupting a vital communication line in the brain.
Wow.
And the study focused on how this deletion affects the thalamus, which is a central hub for information processing
Okay.
and relaying messages to different parts of the brain.
So the thalamus is kind of like Grand Central Station in the brain?
Exactly.
Okay.
The thalamus is constantly receiving and sending signals, coordinating activity throughout the brain.
Uh-huh.
And what this study found is that this genetic deletion disrupts the thalamus,
Okay.
impacting sensory processing and even learning.
And this is where ketamine comes in, right?
Yeah.
Because they found that low doses of ketamine actually help to normalize some of this brain dysfunction.
Yeah, it's a really quite remarkable.
It seems like ketamine is stepping in and helping to restore communication,
It does.
which is pretty cool.
However, it is crucial to emphasize that this is just one study,
Right.
and more research is absolutely needed.
Of course.
We're just starting to unravel this complex interplay
Yeah.
between genetics, brain communication, and the potential therapeutic effects of ketamine.
Absolutely. And on that note, the researcher was very clear about cautioning against self-medicating with ketamine.
Of course.
We're definitely a long way from understanding the long-term effects.
Right. It's crucial to remember that while these findings are exciting, responsible and ethical research is paramount. We need rigorous scientific investigation to ensure safety and efficacy before considering ketamine as a treatment option for autism and Tourette's.
Okay, well, buckle up because this last one takes us in a totally different direction.
Okay.
It's a paper called A Novel Framework for Ketamine-Assisted Couple Therapy.
Right.
You're probably thinking, ketamine for couples therapy, what?
Does seem like an unexpected application, doesn't it?
Definitely. But this paper makes a really intriguing case for how ketamine's unique effects could be harnessed to help couples work through some really deep-seated issues.
It does.
So can you kind of walk us through how that might work?
Of course, the paper outlines a framework where ketamine sessions are integrated into traditional couple therapy.
Okay, so it's not just about giving couples ketamine and sending them on their way.
Right.
It's about using it as a tool within a structured therapeutic process.
Exactly.
So essentially the idea is that ketamine's ability to promote neuroplasticity,
Yes.
reduce inhibitions, and enhance emotional openness could make it a really powerful catalyst for change in couple therapy.
It could.
So let's break that down a little bit. Neuroplasticity.
Okay.
That's the brain's ability to change and rewire itself, right?
Yes.
So ketamine could actually help couples be more open to change
Right.
and break out of these negative patterns they get stuck in.
Exactly.
Okay. And by reducing inhibitions, ketamine could help couples communicate more openly and honestly, even about difficult topics they might otherwise avoid.
That's right. It's like lowering those defensive walls that can build up in relationships.
And I imagine enhanced emotional openness could help couples connect on a deeper level,
Yes.
even in the midst of conflict.
It could.
It's like allowing them to see each other and themselves with more compassion and understanding.
Precisely. And the framework outlined in the paper emphasizes the importance of integration sessions after the ketamine experience.
Okay.
This is where couples would process their experiences and work with a therapist to develop new communication skills and strategies for resolving conflict.
It sounds almost revolutionary.
It's definitely a fascinating area of exploration, particularly for couples struggling with issues like trauma or mental health challenges that can make it even harder to communicate effectively.
So we've gone from using ketamine to treat severe depression,
Right.
to potentially helping people with autism and Tourette's.
Yeah.
And now we're talking about revolutionizing couples therapy.
It's remarkable how ketamine is revealing the incredible potential of our brains for healing and growth.
All right, so that wraps up our initial exploration of the potential benefits of ketamine. But of course, there's always another side to the story.
There is.
And that's exactly what we'll be diving into in the next part of this deep dive.
Okay.
We'll explore some of the challenges and concerns surrounding the use of ketamine, and you definitely won't want to miss it.
Sounds good.
Okay, so we've seen how ketamine is making waves in the world of mental health and even relationship therapy. But let's shift gears a bit and talk about the other side of the coin, the potential challenges and concerns surrounding its use.
Right. It's important to remember that while the potential benefits of ketamine are exciting, it's crucial to approach its use with caution and a balanced perspective.
Absolutely. So what are some of the key concerns that researchers and clinicians are grappling with?
Well, one of the biggest concerns is the potential for abuse.
Okay.
Ketamine can produce dissociative and euphoric effects,
Right.
which unfortunately makes it susceptible to recreational misuse.
Yeah.
We need to be very mindful of this risk as ketamine becomes more widely available.
Right. And that was highlighted in the article about ketamine and autism.
Yes.
The researcher specifically cautioned against self-medicating because we simply don't have enough information about the long-term effects yet.
Exactly. And that's why it's crucial to have strict regulations in place and to ensure that ketamine therapy is administered under the guidance of qualified healthcare professionals.
Speaking of access, that's another concern, right?
It is.
Ketamine therapy isn't exactly cheap or readily available. It's not always covered by insurance, which means it's often only accessible to those who can afford it.
That's a very real and important issue.
Yeah.
If ketamine truly holds the potential to help people suffering from various conditions,
Right.
then we need to address these disparities in access. It shouldn't be a luxury treatment.
Okay, so accessibility is a major concern. What about the potential for side effects?
Yeah.
Especially with long-term use.
That's another area that requires further research.
Okay.
While ketamine generally has a good safety profile when used appropriately,
Right.
there are potential side effects that need to be carefully monitored.
I remember one of the sources mentioned potential urinary tract issues with long-term use. That sounds concerning.
Yes, there are some reports of urinary tract problems in individuals who have used ketamine heavily and chronically.
Okay.
And there's also the risk of psychological dependence,
Okay.
particularly in individuals who are already prone to addiction. More research is needed to fully understand these risks and to develop strategies to minimize them.
So it sounds like we're walking a tightrope here.
In a way.
We need to balance the potential benefits of ketamine with the potential risks
Yes.
and ensure that it's used responsibly and ethically.
Absolutely.
But how do we do that?
That's the million-dollar question.
Yeah.
There are no easy answers, but one crucial aspect is informed consent.
Okay.
People considering ketamine therapy need to be fully informed about the potential benefits and risks.
Right.
They also need to understand the nature of the experience itself,
Okay.
which can be quite intense and even psychedelic for some people.
You mentioned psychedelic experiences. Can you elaborate on that a bit?
Sure, ketamine can induce altered states of consciousness,
Okay.
sometimes described as a feeling of dissociation
Uh-huh.
or a sense of being outside of oneself.
Right.
For some people, these experiences can be deeply profound and insightful,
Yeah.
offering new perspectives on their problems or emotional blocks.
I can see how that could be very therapeutic,
Right.
especially in the context of therapy.
Exactly. But for others, these experiences can be disorienting, frightening, or even overwhelming.
Wow.
It's really important to ensure that people are properly prepared and supported before, during, and after a ketamine experience.
So it's like having a guide to help you navigate those uncharted waters.
Precisely. And that's where the role of a skilled and experienced therapist becomes crucial.
Right.
They can help individuals process and integrate those experiences,
Yeah.
ensuring that they are ultimately beneficial rather than harmful.
Okay, so informed consent and the role of a therapist are key factors in ensuring responsible and ethical use of ketamine.
They are.
Are there any other considerations we should be thinking about?
Well, as ketamine becomes more widely accepted and integrated into mainstream medicine, we also need to consider the broader societal implications.
Okay.
How will this affect our healthcare system, our social norms, even our fundamental understanding of mental illness and treatment?
Wow, that's a really big question.
It is.
It sounds like ketamine is challenging us to rethink some of our most basic assumptions about the brain consciousness and healing.
It is, and it's raising important questions about how we define mental illness, how we approach treatment, and ultimately how we view ourselves as human beings.
Yeah.
It's an exciting time for science and medicine, but it's also a time for deep reflection and careful consideration.
It's like we're standing at a crossroads.
Yeah.
And the path we choose will have profound implications for the future of mental health care.
You've summed it up perfectly.
So we've covered a lot of ground here.
We have.
We've seen the amazing potential of ketamine,
Right.
but we've also acknowledged the very real challenges and concerns that need to be addressed.
We've highlighted that with any powerful tool, there comes a responsibility to use it wisely and ethically.
That's a great way to put it. But where do we go from here? What does the future hold for ketamine research and its potential applications?
Right.
Well, that's exactly what we'll be exploring in the final part of this deep dive. So we've seen ketamine's incredible potential, for treating everything from depression to couples therapy.
Yeah.
But we've also, highlighted some of the challenges that come with it.
Right.
So where do we go from here? What does the future hold for this game-changing treatment?
Well, the future of ketamine research is really exciting.
Yeah.
It's not just about figuring out how to use ketamine effectively, but also about what ketamine can teach us about the brain itself.
So ketamine is like this key unlocking mysteries about consciousness, mental health, and maybe even the nature of reality.
Yeah.
We've already seen it challenge traditional ideas about how we think about mental illness and treatment.
That's a great way to put it.
Yeah.
One of the most important areas of research is figuring out exactly how ketamine works on a molecular level.
Okay.
We know it interacts with these things called NMDA receptors in the brain. But the full picture of how that leads to its therapeutic benefits is still being investigated.
So it's like we've got a map of the territory, but now we need to zoom in and explore all the details of the landscape.
Exactly. And on a more practical level, researchers are also exploring different ways to administer ketamine.
Okay.
Right now, intravenous infusion is the most common method.
Right.
But there's a lot of interest in finding less invasive options like intranasal, oral, or even subcutaneous delivery methods.
So making it more accessible and maybe less intimidating for patients.
Right.
What would be the advantages of those different delivery methods?
Well, each method has its pros and cons.
Okay.
Some might be faster acting.
Yeah.
Some might have longer lasting effects. And some might have fewer side effects.
Okay.
It's really about finding the best fit for each individual and their needs.
It's like tailoring the delivery method to the person,
Yes.
just like we were talking about with the personalized treatment approaches.
Exactly. Another really fascinating area of research is combining ketamine with other therapies.
Oh,
We talked about ketamine-assisted psychotherapy.
right.
But researchers are also looking at combining ketamine with mindfulness practices,
Oh, wow.
brain stimulation techniques,
Okay.
and even virtual reality experiences.
Wow, that's combining cutting-edge science with ancient wisdom.
It is.
What are the possibilities there?
The possibilities are pretty mind-blowing.
Yeah.
Imagine using ketamine to help someone access a deep meditative state, or to enhance the effects of therapy focused on trauma or addiction.
Wow.
The research is still in its early stages,
Right.
but it has the potential to revolutionize the way we approach healing and personal growth.
It's like we're building this incredible toolbox of interventions that can be customized to meet each person's unique needs.
Exactly. And as we learn more about the long-term effects of ketamine,
Yeah.
we can start to develop ways to maximize its benefits and minimize any potential risks.
Okay.
This might involve combining ketamine with other medications,
Okay.
or even developing new drugs that target the same brain pathways but have a better safety profile.
So ketamine is not just a treatment. It's also paving the way for a whole new generation of treatments that could transform mental health care.
That's a great way to put it.
Yeah.
It's like ketamine is the first explorer venturing into uncharted territory,
Right.
opening up new possibilities for understanding the brain and developing innovative treatments.
It's definitely an exciting time to be alive, especially if you're interested in the frontiers of science and the human mind. Who knows what we'll discover in the years to come?
And of course, as we continue down this path,
Yeah.
we need to remain mindful of the ethical implications. As ketamine becomes more widely used, we need clear guidelines and protocols to ensure it is used safely and responsibly.
Absolutely. We need to make sure that these groundbreaking treatments are used for the benefit of all, not just a select few.
Right.
So what does this all mean for our listener?
Well, it means we're on the brink of a revolution in mental health care.
Yeah.
Ketamine is just one example of a new wave of treatments that are challenging our understanding of the brain and its incredible capacity for healing. It's an invitation to stay curious, stay informed, and keep exploring the possibilities.
And that, dear listener, is your deep dive into the fascinating world of ketamine research. If you're as intrigued as we are, we encourage you to check out the source material linked in the show notes. Keep questioning, keep learning, and keep diving deep.